Hey everyone, and welcome to The Explainer. Today, we are diving into what is honestly a genuine medical mystery. We are cracking the case on vitamin B12 testing. Because as it turns out, a standard blood test might literally be lying to you about your health. Let's get right into it.
So tell me if this sounds familiar. You're dealing with some really frustrating, maybe even debilitating symptoms. We're talking exhaustion, brain fog, maybe some weird tingling in your hands or feet. You finally go to the doctor, they draw your blood, and the results come back perfectly normal. You're left thinking, wait, can I actually be B12 deficient with a completely normal lab result? The short answer? Absolutely yes. Pinning down a B12 deficiency is surprisingly tricky, and a normal serum result that just happens to fit neatly into a lab's reference range definitely doesn't tell the whole story.
All right, let's get into Section 1, the suspects. Total B12 versus active B12.
To really understand this, I want you to think of your bloodstream as this massive, complex supply chain. When a doctor runs a total B12 test, they're basically asking, hey, how much B12 is sitting in the warehouse? But the active B12 test asks a way more important question. How much of that B12 is actually loaded into the delivery trucks and heading straight to your cells? This is the core difference between these two tests, and honestly, it completely explains why one test might look fantastic while your body is actually starving for the nutrient.
Let's break down that warehouse a little bit more. Total B12, which you'll often see on your lab sheet as serum or plasmacobalamin, literally just measures the total amount of circulating B12. But here is the catch. Most of that B12 is bound up by a carrier protein called haptocorin, and when it's bound up like that, it's just sitting there. It is not immediately available for your cells to use. So just because your warehouse is packed to the ceiling, that does not mean your cells are getting the materials they actually need to function.
On the flip side, we have active B12. Clinically, this is known as holotranscobalamin, or holoTC if you want to keep it short. This is the biologically available fraction of your circulating B12. This B12 is bound to a totally different protein called transcobalamin, which forms the exact complex your cells actually absorb. So this test is measuring those delivery trucks that are pulling up to your cells right now, ready to be unloaded. Because of this, research actually shows that active B12 can sometimes spot a deficiency way better than total B12, especially when your total numbers are just hovering in that weird borderline range.
Which brings us to Section 2, the reference range trap, normal versus diagnostic.
Okay, there's a huge misconception about how we actually read our own health data. You see, a laboratory reference interval really just describes the values commonly seen in a specific population. It's basically just an average of all the people who happen to go to that specific lab. But a diagnostic threshold? That's the specific value medical professionals use to determine if a disease or deficiency is actually likely. Those are two very different things. So when your doctor says your B12 is normal, they might literally just mean you fit the lab's population average. It doesn't mean your level is actually clinically optimal for you.
Let's look at how medical guidelines try to navigate this trap. The NICE guidelines, that's the National Institute for Health and Care Excellence, have these specific diagnostic thresholds for active B12 in adults. It's basically a traffic light system. In the green zone, above 70 picomoles per liter, a deficiency is pretty unlikely. Down in the red zone, under 25, a deficiency is very likely. But look at that yellow zone in the middle between 25 and 70. That's the indeterminate zone. It means a deficiency is totally possible, but we just don't know for sure based on this one number alone. And guess what? It's exactly in this tricky yellow zone where patients with very real, very severe symptoms tend to get stuck.
So, what happens then? Well, that brings us to Section 3, hidden clues and functional markers.
Our best hidden clue here is something called methylmalonic acid, or MMA. Think of MMA kind of like the dark exhaust smoke coming out of an engine that just isn't running right. When your body doesn't have enough B12 to complete certain metabolic reactions, this MMA starts to accumulate in your blood. In fact, the National Institutes of Health considers MMA the absolute most sensitive marker for checking your B12 status. So if your standard tests are stuck in that borderline yellow zone, checking MMA acts as the ultimate tiebreaker to confirm a hidden deficiency.
But as any good detective will tell you,
no clue is 100% flawless. There are a couple of big caveats with MMA. For one, if your kidneys aren't working perfectly, MMA can build up totally independently of your B12 levels. Also, MMA naturally just tends to increase a bit as we get older. This is a brilliant example of why you can never ever just look at a spreadsheet of lab numbers in isolation. Clinical context, like how old you are and how healthy your kidneys are, is absolutely mandatory when interpreting this stuff.
Now, there is another functional clue we can look at, and that's homocysteine, because B12 is needed to convert homocysteine into methionine. If you're lacking B12, your homocysteine levels are going to shoot up. But it's generally considered a bit less specific than MMA. Why? Well, because homocysteine can also get completely thrown off by your folate levels, your vitamin B6 status, and again, your kidney function. So it's a super helpful piece of the puzzle, but it definitely has a lot of moving parts.
Let's move right along to Section 4, the false alibis. What skews your results?
There are actually quite a few common confounders that will totally throw off your blood work. First up, B12 supplements. If you pop a B12 vitamin and then go get your blood drawn, your measured B12 concentration is probably going to look amazing. But that doesn't necessarily mean your cellular deficiency is actually fixed. Then you've got medications. Everyday things like metformin or long-term acid suppressors like PPIs can severely block your B12 absorption. The same goes for various GI conditions or stomach surgeries. All these factors can artificially inflate or alter how your blood levels look on paper.
And here is a truly wild special case for you. Recreational nitrous oxide. You know, laughing gas. Nitrous oxide literally inactivates the vitamin B12 in your body. But here's the crazy part. If this happens, your total and active B12 tests might still look completely normal. Standard testing just completely fails here. So if nitrous oxide is in the picture, medical guidelines are very clear. Doctors have to skip the standard tests altogether and go straight to checking those functional clues we just talked about, like MMA or homocysteine.
All right, Section 5, solving the B12 puzzle, a practical strategy.
So how do we actually put all this together? Current medical guidelines lays out a pretty logical 4-step approach. Step 1, you start with either the total B12 or the active B12 test. Step 2, if the result is clearly in that red zone, like very low, you investigate and treat it right away. Step 3, and this is the crucial one, if the result is borderline, or if it says normal but you still have terrible symptoms, you have to follow up by testing a functional marker like MMA. And finally, Step 4, don't just treat the low number on the page. You have to investigate the root cause of why the deficiency is happening in the first place.
And I really can't stress this enough. Do not ignore your symptoms just because a piece of paper says your blood count looks fine. B12 deficiency can cause severe neurological issues. We're talking numbness, tingling, losing your balance, memory problems, and real trouble concentrating. And these terrifying symptoms can happen without any obvious signs of anemia. So your red blood cells could look totally normal, but your nervous system is essentially screaming for help.
I also want to quickly call out a specific risk group here. For anyone following a vegan or plant-based diet, please keep this in mind. While a well-planned plant-based diet is fantastic, unfortified plant foods are simply not a reliable source of vitamin B12. Period. If you are vegan, getting reliable B12 from fortified foods or a direct supplement is absolutely essential for your long-term health.
To really put this diagnostic challenge into perspective, look at this massive number, 181,000. In a 2026 population study, researchers analyzed over 181,000 B12 test results. What they found was that simply switching from the total B12 test to the active B12 test completely changed who was classified as deficient and who wasn't. Active B12 left far fewer people stuck in that yellow indeterminate zone, but it was also way more expensive to run. So the big takeaway here is that changing the test changes everything, and we honestly still need more research to figure out exactly which testing strategy gives patients the best outcomes.
Which really brings us home to this incredibly grounding quote. The goal isn't to chase the highest possible B12 number. The goal is to have adequate B12 available to support normal biological function. It is so easy to fall down an internet rabbit hole, staring at optimal ranges and trying to force your lab numbers higher and higher. But remember, different labs use totally different units. 70 picomoles per liter of active B12 is completely different from 70 picograms per milliliter of total B12. You can't just chase a number. You have to support how your body actually functions.
And that leaves us with one final, provocative question to wrap up our explainer today. Are you treating the lab number or are you treating the patient? The ultimate goal here is to catch a deficiency before any irreversible neurological damage happens. So if your labs are borderline, please don't just accept a normal stamp if you still feel awful. Talk to a healthcare professional. Bring up your specific symptoms, your diet, your medications, and ask if a functional test like MMA might just be that missing piece of your puzzle. Keep learning, keep asking those hard questions, and never stop investigating your own health.